Good morning, everyone, and welcome to our panel on music and social prescribing, holistic health and wellness. My name is Annie Sommier. I'm the Director of Education and Community at the Orchestre Symphonique de Montréal, and I'll be moderating today's panel. I want to start by thanking the organizer of the conference. Thank you, the Glenn Gould Foundation, for bringing us all together this week for having these very important discussions. Today, we will explore an idea that is both simple and powerful. Music can be used to support health, well-being, and social connection. Around the world, and here in Canada, social prescribing is helping people find community-based activities that reduce loneliness, improve mental and physical health, and strengthen the links between healthcare and community. I'm very pleased to introduce our three panelists, who each bring a different perspective to the discussion. Dr. Sue Bennett will explain what social prescribing is, why it matters, and share examples from Canada and around the world. Tina Fedeschi will share how music can change the lives of children and families by building confidence, belonging, and opportunity. Dr. Arla Good will show us the scientific evidence on how group singing improves health and how it can become part of healthcare systems. Together, their insights will give us a global, community, and scientific view on the power of music in social prescribing. Dr. Sue Bennett.
Thank you for your kind introduction. Is my microphone on? Yes. Thank you. Good morning and bonjour to you all. It's a wonderful opportunity for me to talk about my passion here today, social prescribing and impact on the mental health and well-being of children and youth. So you've probably heard a lot about social prescribing. Could you just put your hands up, anybody who's heard of it? Okay, it's a growing movement, and that's great. So most of the audience here. But I'm not sure you're aware of the specific description, the definition of social prescribing, which actually was from a Delphi study, an international Delphi study of experts. And in 2023, my co-investigator, Caitlin Moule, it was the first part of her dissertation, developed the international definition, which is so important so that we can compare research, evaluations, and in order to be able to advocate for social prescribings in different centers. So social prescribing is a means for trusted individuals in clinical and community settings to identify that a person has non-medical health-related social needs and to subsequently connect them to non-clinical supports and services within the community by co-producing a social prescription, a non-medical prescription to improve health and well-being and to strengthen community connections. And it's a bit of a long definition, and for many years, health professionals have been connecting their patients with community activities. It's part of what we do. But this is a little bit different in the sense that you will hear, I'll show you how it's implemented, but the co-production, as a physician, I'm prescribing antibiotics, for example. You give it 3 times a day and you take it for 10 days, and that's one directional, and it's got nothing to do with what the patient says to me, this is what you need. Social prescribing is about a co-production, a meeting with that individual and working together to find out what are the joys, what are the strengths, what are the needs, what are your dreams, and bringing that together. So the co-prescription is incredibly important. And social prescribing is actually amazing. This slide is so foundational to a paradigm shift in our health system, which is biomedical traditional approach. What's the matter with you is when you go to the doctor, you've all heard that. What's the matter with you? Is anyone asking you what matters to you? Now, this is really a change in integrating health and personhood to the relationship you're having with your physician. So we are going in social prescribing from not what's the matter with you, but what matters to you. And it's incredible because you're giving, in this process, children and youth a voice in a way that I've seen somebody nodding. As young people, you might not be asked, their parents might be asked, what's the matter with this child? Somebody's asking you, what matters to you? And somebody's listening, and somebody's taking action on that through a social prescribing process. There's a bit of a delay on this. So, what is social prescribing in action? So, we have trusted individuals in clinical and community settings, and they identify that a person has non-medical health-related social needs, and that identifier, who could be a health professional, a physician or a nurse practitioner or a social worker, or could be anybody actually in the community. This is what's important to understand, that anyone can do social prescribing. But that identifier connects the person to non-clinical supports and services within the community, so it's direct. Or, how we are working is the identifier refers the person to a connector, or link worker as they're called in England. But either way, the connector connects the person, or the identifier connects the person to these supports in the community through this co-production of a social prescription. Now, I did say that many people have been working with connecting people with the community activities, and we could use it as signposting. In the past, we were signposting, seeing the family, and maybe the child said they wanted to play an instrument. We would say, okay, point the finger, orchestra is somebody you want to go and connect with. And you know, that family may have all kinds of questions, but they may have transportation difficulties. They may not know how to navigate being newcomers to the country, or wonder what that's about. The important piece is to have a connector who's supporting the individual to that organization and working with the organization to make it happen. So it's a little bit different from what was happening previously. Why is social prescribing important? Unquote, medical care is estimated to account for only 10 to 20% of the modifiable contributors to healthy outcomes for a population. The other 80 to 90% are sometimes broadly called the social determinants of health. And these are the conditions that people live in, that these are impacting health. It's not the healthcare system that the doctors and the physicians and the hospitals are going to be curing you necessarily. Now, they can do very good work, not to dismiss the importance of that, but through impacting the environment, and the child, we recognize, lives within the family. There are parenting behaviors there influencing the child, their health and mental health and well-being. And there's housing, there's the schools, there's the community resources, there's the employment of the families where they work, and economics, of course, and the political climate. Are the politicians and the government supporting the communities to be able to have all these resources that we need? So why is social prescribing important? Well, and the UK have been the leaders in the research for looking at the impact on individual health systems and community. And what they have found is that there is positive impact on the individuals. Most of the research has been done with adults at this time. There's little research, and I'll talk about that, with children and youth, but there are positive signs. But the impact on the individual's health and well-being, mental health and physical health has been shown in the UK with the elderly. Impact on the health systems. And it's been shown that in England, where the family doctors are funded by the UK government to have link workers, if they identify a non-medical health-related social need, they then can bring in their funded link workers and say, please follow up with this child. That's a referral for social prescribing. And it's been shown that through that process, there's decreased visits to the family doctor in the healthcare system and to the emergency room. So it's saving money for sure, which is why clearly the government have taken this up and funding it. There must be some economic reasons for that. And in the community, this is about community engagement. People have a sense of belonging, that they live in the community that they know. There are economic studies. It is, I understand, yesterday there was a panel about the economic impact of the arts. I wasn't, but again, coming from the UK, that's going to be on a website and available, because it's really difficult to get the indicators of the economic impact. And I know what they've done in the UK, looking at the health system. The physicians have, as I mentioned, decreased visits by patients who are in social prescriptions or emergency room. But our families, as you know, there's a health crisis across the country. Many people don't have a primary care physician, and they're going to emergency rooms, if at all. Many of the families that I see in an underserved community sit it out. They don't go to emergency rooms for 14 hours wait list, or they'll go to a walk-in clinic, if at all. So it's difficult to do those economic studies. We're all talking these days in the health system about personalized medicine, precision medicine, and there's some very interesting and exciting research actually that's linking the genes, looking at the genes of patients and linking it with medication that fits with their genetics, potential for particular diseases. So it's really becoming individualized. And our promotion in social prescribing is to say we need to go from genetic code to postal code, because where we live, the impact of the environment through the social determinants of health is important as well. So really, for personalized care, we need integration of health and the social. We don't need to just go for the physical health to the doctor and send the mental health somewhere else, or as is siloed in the present system. We're giving positive childhood experiences to children and youth. I don't know if you're aware about the adverse childhood experience studies. It's been going on for 20 years now in the States. It's a longitudinal study looking at the impact of childhood maltreatment, that's physical abuse, sexual abuse, neglect, mental health, and criminal activity within the family. And there's about 10 initially on the studies, but more of these issues going on for the child now. But the impact of having a greater number of these issues and experiences for the child, the negative experiences, impacts the health, physical health and mental health in adolescence, and interestingly in adulthood. It's shown to increase numbers of cancers, cardiovascular disease, stress, psychiatric issues, and impacting next generations, because there's a genetic turn-on called epigenetics for experiences that you can transmit to the next generation. So giving kids positive childhoods can mitigate any existing adverse childhood experiences, but just in themselves, bringing joy and meaning and hope to kids can be obviously positive thing in itself, quite apart from the economics from our perspectives. There's a human rights issue here. The UN Convention on the Rights of the Child is my guiding light. It's been signed by all countries in the world. Actually, that's gone on a little bit too fast. I'll come on to that in a minute. I just want to tell you about the convention, UN Convention. It's been signed by every country in the world, and most countries have ratified it, actually except for the United States and another couple of countries. But essentially, ratification means that the governments have promised kids, that's 0 to 17 years of age, definition of a child, to put the Convention of the Rights of the Child principles into government legislation. So our government in Canada, and I know we have an international audience, has promised to do that for their kids. And I should just quote that the Article 31 in the United Nations Convention on the Rights of the Child states that the child has a right to express their views in all matters affecting them and to fully participate in cultural and artistic life, and governments are obliged to provide appropriate and equal opportunity for cultural and artistic leisure activities. And this is international law. This is a photograph from a couple of years ago from UK in London at one of the first global social prescribing conferences. And to my left is Dr. Michael Dixon. These are the two founders of social prescribing in the UK. Dr. Michael Dixon, he's actually the physician in the royal household. He's King Charles's personal physician. And Dr. Marie Polly, she's an incredible researcher, and the two of them came together on the train from Devon to London in the early 2010s, 2012, and came together and obviously started a movement that is emerging, but also were influential in persuading the UK government through the research subsequently that this was important for our national health system, the UK national health system, which was crumbling. And I've given you a little bit of statistics why it was showing impact, and particularly economic. So these are the founders, and they continue to work through the Global Alliance. I meet every 6 weeks on a call with an increasing number of countries, sharing activities in social prescribing, what works, and learnings across the world. And then we meet up on a biannual meeting somewhere in the world. And there's publications for anyone interested. The National Academy of Social Prescribing, based in UK, in London. They are an incredible warehouse, you might say, for all kinds of resources on social prescribing, and they're having social prescribing around the world. It's every couple of years they're printing what's going on, the latest news, and so a lot of academics coming out of that. And this is just giving you a pictorial of what countries are involved, and this is a few years old now, but social prescribing around the world, with the names of these incredibly important connectors, link workers around the world. They're called different things. So in Canada, the first social prescribing research was performed by the group for the community health centres in Ontario, so-called the Alliance for Healthier Communities. It was the first social prescribing pilot just prior to the pandemic, 2018 to 2020, and over 1,100 clients from 11 community health centres across Ontario received a total of nearly 3,300 social prescriptions. Clients reported improvements in mental health, decreased loneliness, an increase in social activities. Healthcare providers reported improved client well-being and decreased visits. Actually, I should just say also, which hasn't been highlighted as much in the research, the actual prescribers, and that's including myself, I'm working in a health system, not only the health system not having any primary care, but the professionals themselves, many are burnt out. They're really being stressed to do more and more. And social prescribing can bring a lot of joy. Again, we're not in the deficit mode. We're saying to the kids, what are your dreams? Can you imagine in the hospitals we used to have this dream of a lifetime that kids who were perhaps palliative, that didn't have long to live, would be offered a trip to Disney, for example. These were dreams of a lifetime. We're giving dreams to kids right now through social prescribing, which is actually incredibly joyful for me. Across Canada, you can see some of the programs. Again, slides a little old of last year or the year before. There are many more programs now. I just alert you to POC's prescription. BC POC's Foundation are funding social prescriptions for nature, such that physicians across the country now can give a prescription to families for nature exposure, which is equivalent to a family pass to a national park. I live in Ottawa, and Gatineau Park is actually a provincial park, so it doesn't count, but it is actually free to go and visit anyway. But they also have arranged, through a partnership with the Canadian Museum of Nature, to have free family passes for the museum, which is quite costly. It's only free for 2 hours on Thursday afternoon, which isn't great for many families. And the pass enables them to go to special exhibits and everything. So that's what I do quite frequently, is give access to nature through that process. Through the CISP, Canadian Institute for Social Prescribing, is a great place for resources as to what's happening in Canada. So you can find out what latest is there. And just to say that I was conducting I was conducting the first research for social prescribing for children and youth in Canada in 2023 until 24 with the Public Health Agency of Canada grant with many collaborators. And this was conducted with underserved children and youth, 4 to 17, living in Vanier, which is an underserved, high-needs neighborhood within Ottawa. So many of the families didn't have a primary care physician, which is oftentimes the entry into social services. So they weren't having many supports at all, many newcomers, high numbers of Indigenous, everybody was low income. And so we did this social prescribing program. And what was quite incredible was when we reached out to find out in the community what was going on, to link for the social prescriptions to be fulfilled, we got such an outpouring of supports. People couldn't wait to come on board and donate programs and be part of this movement. And I've just given you, let's say, a glimpse of just some of the organizations. We had over 100 organizations. I'd just like to say that when we started the Vanier Hub, as a pediatrician and myself and another pediatrician in 2016, we were working with this population, and it wasn't called social prescribing then, but what I did come to know, we called it the Vanier Social Pediatric Hub. I came in 2016 to hear people talking about a hub, and it seemed a bit strange because it wasn't our hub, and I said, what is this hub? And then I found out that there was this organization called Orchestra who was setting up a hub in Vanier. They were already in the Bronson Center since, I think, 2007, and we're going to hear more about that in the next talk. So I contacted Tina in 2016 and 17, and they were, I must say, it was signposting because we had a good relationship, so I could signpost and connect easily as an identifier to go to Orchestra. But it was in the early days that Orchestra was one of our first, was the first social prescription equivalent. So we're going to hear more about that in a moment. And I think that is my last slide. We will be taking questions. Hopefully you'll have lots for us before we finish. Thank you.
Thank you, Sue, for giving us such a clear picture on what social prescribing is and why it matters. Now we're moving to a very concrete example. Our next panelist, Tina Fedeschi, has built a program that has transformed the lives of 100 of children and youth in Ottawa. Tina will share how music helps young people thrive and build community. Tina.
Well, you can hear I have to bring my own fans. It's such a pleasure to be here. Thank you for the kind introduction, and to be on a panel with such extraordinary women. And of course, to welcome our kids. We have 12 of our superstar wind players from our program in Ottawa, along with our fantastic teacher, Mr. Mark. So it's an absolute honor and privilege to be here. So I'm not sure how many of you know about us. Obviously, you had a lovely introduction with the kids playing. But for those of you who are unfamiliar with Orchestra, we are a social development program with the goal to empower kids and build community through the universal language of music. And with the passionate belief in the transformative power of music, we began orchestra in 2007 with 27 children. We now serve over 800 children and youth from 62 linguistic and cultural backgrounds. We offer free programming and instruments to children and youth living in underserved communities in Ottawa. So just imagine what happens when you put an instrument into the hands of a child. What happens when they sing and play music together 2 to 3 times a week from the age of 5 to 18? Well, I've completely forgotten this thing. There we are. So there you go. You've got a little visual there. And this is what we do. But before we answer that question, I realized when I was preparing for this little presentation that I should share my personal story a little bit because it's very relevant. So I had a youth that was both privileged and dysfunctional. And I'm not used to sharing this with my kids. My salvation was music and playing the flute in the orchestra. I really think it saved me. I don't know what I would have done without it. Playing music gave me the means of personal expression. I could pour my heart out with the flute, but I couldn't with words. So this expression gave me a much-needed relief. And I was just at the age of 14, I remember the first time I played in a really, really good youth orchestra. And I was so blown away by the joy, the energy, the harmony, the commitment, the generosity, and the overwhelming sense of connection. And I realized, too, that I was incredibly privileged to have that life-transforming experience when it was out of reach for so many. And I also realized that I was incredibly lucky to have found my own ideal prescription just by chance to help me through my life. So I really don't know, if I hadn't had music in my life, obviously I wouldn't be standing here now and these kids probably wouldn't be in the audience. Life goes on and you have your experiences. And I decided with the co-founders to create Orchestra to bridge that gap, to fill those needs, to give the kids who wanted to find their voice, who wanted to create a community and find their people and become the best and most authentic version of themselves through music. And you know, our goal is not just musical excellence, it's excellence of teamwork, of caring, and of the heart. So that was a goal that I kept with me all my life, and I couldn't be prouder for all of us to be here today and to share this story. So when a child or youth come to us through social prescription, they already have identified what matters to them. Music matters to them, and they are passionate to learn about music. And these kids are already facing a variety of challenges. And so it's through the joys and very different challenges of playing and singing together when they become part of our love-centered community, where the sense of belonging, social and engagement, and real confidence can blossom. So at this point, I want to share what the co-founders and I came up with right at the beginning when we created Orchestra, and it's called the 10 Leading Notes. So guys, would you just come to the front? Because they're going to help me do this. The 10 leading notes, learned from day one So whether you're 5 years old or 18 years old, this is what you're going to do. The 10 leading notes bring our values to life through interactive rhythms, playful words, and shared experience, transforming lessons in character building and teamwork into joyful participation. Oh. Yes. Now, let's see if this is going to work. Oh, that didn't work. Okay. Oh, dear. I'm supposed to go backwards. How am I supposed to? I'm not sure if the video is going to work. It doesn't matter. We've got the real deal here. Okay. So, we need audience participation. Okay? So, if you listen, you have to really speak super clearly so everyone can hear the words. So, we need tap, 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 snap, tap, tap. Okay. Together we build respect, respect. Together we build respect. Together we build respect. Play every note with love, la 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 la. Play every note with love. All you need is love. Praising, 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 praising comes first. Praising, 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 praising comes first. Let the music move you, let the music move you, move you, move you. Let the music move you. You are your own best, you are your own best, you are your own best teacher. You are your own best, you are your own best, you are your own best teacher. Treasure your instrument, it is your voice. Treasure your instrument, you have your choice. We will find it very funny, it will cost us lots of money. Treasure your instrument, it is your voice. Root to read, bend your knees, elevate, sing a song, no time to stop. You're not on a couch. Root to read, bend your knees, elevate, sing a song. Music is fun, music is fun, music is fun for everyone. You and me, we all agree. Music is fun for everyone. We help one another. We help one big family. We help one another. One another. We help. Excellence is a habit. Practice daily, practice daily. In my reach, I can grab it. Practice daily, practice daily. Every day, on a new try to play. Excellence is a habit. Practice daily, practice daily. In my reach, I can grab it. Practice every day. Hey! Okay. Thank you, guys. So we do that from day one in all of our performances, all of our concerts. They're part and parcel of our concerts. All the audience takes part. The parents know the words as well as the kids. We use these leading notes for teaching purposes, behavior. What's the first leading note? Together we build respect. And it's really useful because it really helps. And it's also a great pedagogy for rhythm. Treasure your instrument, or you are your own best. It's triplet, duplet. So we can really use it as a rhythm tool as well. So it's really been the core of who we are. There are many global studies that show how musical training strengthens literacy, numeracy, teamwork, problem solving, commitment, resilience, and the list goes on. It's a magic pill. And we can certainly back that up with our results this is from last year. The one I particularly love is that 98% of students say they are aware of the importance of being kind. Now, while capturing data and tracking impacts are vital for funding, vital for, building credibility, we keep coming back to our stories because it's the stories that matter. That's what matters to the kids. And I have learned that over the years, I've looked back on our success and realized that we have never been outcome-oriented. We have to write outputs and outcomes and all those things in grants. But you know, one of our percentages data, 100% of our orchestra graduates complete school and go on to post-secondary education. We have never tried to make that happen. Never. And we realized what we do, and I think it's the key, is that we create the conditions for success. Just like when you're planting a garden, you create the soil, the sun, the shade, the manure, much. Sometimes we need lots of manure. We create the conditions, and the flowers blossom, the trees blossom, and the kids flourish when you create the right conditions. So I think that is where I'll probably stop, because I think that is really the key. For us to be a destination for social prescription, I think the reason we can do that so well is that we aren't a short-term program or a passive experience. We are an ongoing relationship. The one word, I was once asked a few years ago, if you had to explain orchestra success in one word, what would it be? And it was belonging. And I think that sense of belonging is what creates this magic. Thank you.
Thank you so much, Tina, for this inspiring presentation and reminding us that music can be a real magic pill, something that brings joy, resilience, and connection without side effects. Maybe, sore fingers if you practice too much. It reminded me I had a great pleasure of being involved in the development of El Sistema inspired initiative back in Montreal. So our music director, Raphaël Payare, when he arrived in Montreal with the OSM, he wanted to create a program that was reflecting what he had gone through back in Venezuela. So I had the pleasure to work alongside my colleague Geneviève Vigenès, who is here with us today and who manages this wonderful El Sistema OSM program back in Montreal. And we launched it last year, and we're in our second year this year. Over 100 kids already doing 12 hours of music per week from Monday to Thursday. And we're in the early beginnings, but we already see so much of what you shared, and it's really exciting for us to see that and to imagine what it can grow into. So our final panelist, Dr. Arla Good, takes us into the science of why this works. As a leader of the Sing Well project at the TMU, she studies how group singing improves mental health, physical health, and social connection. She will share research findings and practical lessons on how singing together can become part of social prescribing. Arla?
Thank you. Thank you. I wish I brought my cheering squad today. Thanks, Ingrid. So thank you so much for having us here today. I'm really excited to talk to you about the Sing Well project. We're going to jump ahead in the timeline of an individual by about 50 years and talk about older adults. And so I'm an adjunct professor here at TMU in the Department of Psychology, and I study the science of singing. I did say that I would talk a lot about the science of why this works, but I'm actually going to combine that all into one slide, you'll see. And I'd like to talk more about why singing and Sing Well fits within a social prescribing model. So I'll just share a quote about how Sing Well started. It's an individual who's living with Parkinson's that had been singing in a choir. And she said, "At this point, I don't feel like my Parkinson's defines me as much as it used to. Now that I've been singing, I feel that I'm also a singer, part of a vibrant community. And so this shift from a deficit-based identity to a strength-based identity really inspired me to capture this, document this, and try and advocate for more singing groups like this that exist so more people can experience these benefits. So what is Singwell? Singwell is a network that's housed here at TMU. It's supported by the Government of Canada, and it connects over 50 international researchers and 100 community partners across Canada. And our mission together is to advance research, to understand what is happening when we're singing together, and to bridge research with practice and community. We're in year 4 of 7, and this is where we're starting to shift from our evidence building to our real world implementation. Our vision is to see social prescribing as an established pathway for individuals. In our project with Singwell, we're interested in specifically individuals, older adults who are living with communication challenges. We want to see more accessible, inclusive singing groups, affordable singing groups across Canada that are evidence-based, so that's the research that we're doing, that we produce guidelines for individuals to ensure that these groups are safe and effective, and that we ensure that all key stakeholders, including other researchers, medical professionals, and the decision makers, know that this is an option for interventions for these types of individuals. So as I said, Singwell focuses on individuals with communication challenges because we do look at the rehabilitation benefits of singing together. So individuals living with Parkinson's, stuttering, lung disease, hearing loss, and aphasia. But this is the slide where I ensure you that singing is for everybody, regardless of how well you think you sing, whether you've been told to mouth along to the choir instead of singing. This is about inclusion and equity. It's about showing up with an open mind and participating and having fun. It's not about how you sound. So this is something that anyone can glean benefits from if they show up with this kind of attitude. So why does group singing work? I promised you I put this all onto one slide. Here it is. So these are some of the benefits that we are exploring when we're singing together. This is it's a holistic impact across different domains of body, mind, our social well-being, our communication function. So what Singwell does is we start choirs and we track them over 12 weeks. We look at this longitudinal outcome. So we start at baseline and we collect things like psychosocial well-being, how well they're using their voice, and then at the end of 12 weeks, we track the same measures. And so this is where we're seeing improvements on psychosocial well-being. We're seeing strengthened voice, better breathing, better hearing in hearing loss groups. I say it's like going to the gym for your voice or for your hearing, but it's a whole lot more fun. And we also assess choirs or singing groups before and after singing together, like in an individual session. So after 45 minutes, we take saliva samples so we can look at hormones. We take heart rate samples so we can look at heart rate variability, which is another measure of stress. We look at mood, and so there's a whole slew of benefits here that we can dig into in another talk. But in general, what we're seeing is singing improves your mood, it decreases your stress, it improves your pain thresholds, which is something that we're seeing time and time again, which is really interesting, that after you're singing together, you can withstand more pain. Connect with me after if you have any questions about these benefits, because I want to move on. Why does singing work? Singing is universal, so this is something we see throughout history and across the globe. I like to say that singing is our human right because we are born with this instrument built in, and it's something that we can all do. Even if you don't think you're a singer, you can show up, and it's pleasurable. So I think actually pleasure is one of the most important ingredients here, especially when we're talking about rehabilitation. That if it's fun and you're showing up week to week, that's really important for the intervention adherence. And that's what's getting you to show up if we say that you came for the voice training and you stayed for the friendship. It's scalable, so you can grow these groups. It's cost effective. What you need is a space and a trained leader to lead this. And there is an availability of facilitators with just a little bit of training. So at Singwell, we look at individuals with backgrounds from choral direction, music therapy, speech language therapy, community musicians. So with just a little bit of extra training, any individual can really lead a group like this. So what are the missing pieces? And I'd like to express that these are challenges, not barriers to creating a pathway of social prescribing or singing on prescription. We need to see some program models out there with practical guidance so that we know that these groups are safe and effective. Training programs for the leaders to ensure this safety, integration into healthcare, and continued evaluation of these programs. So what Singwell is doing in order to help advance the singing on prescription model is by developing these types of best practices that are evidence-backed. So we are interviewing people who are leading singing groups, we're doing focus groups, and we're trying to understand what are their best practices, what decisions do they make when they're leading these groups, how do they have the groups sitting? Are they in like a soprano, alto, tenor? Are they sitting in a circle? Where are the songs coming from? How are they choosing the repertoire? What time of day is the program? Are they charging money for the program? We have a long survey that they fill out, and we've been compiling these into best practice guides that are shared on our website. And these guides are going to come together to be part of an accreditation program so that we will be training individuals, as I said, from these different types of backgrounds. So people who come from a background of music therapy or from speech language therapy to get the training they need to feel confident leading a group. And this builds trust, legitimacy, and scalability of these types of programs. We're also populating a singing map. This is the group singing map across Canada. So we are connecting singing groups across the country to help individuals and healthcare providers locate the nearest singing group. You can search by population. So you see there's aging adults, aphasia, dementia, and you can find a singing group near you. There's also a little icon for if the group is online. So this is something you can participate in from anywhere in the country. So this is live on our website, so you could be using this to refer somebody to a choir today. And we are doing research on these types of pathways where it's going from healthcare provider to choir or singing groups. And we are building collaborations with different partners to explore these pathways. So one example in Ontario, up at Chigamik Community Health Centre, they were part of the Alliance, the social prescribing pilot that happened here in Ontario. So they already had this pathway built. And what we did was we started a singing group up there for people with lung disease. And so every physician or allied healthcare professional in the area knew about this singing group and was able to refer their clients who had lung disease or breathing disorders to the singing group. This started about 2 years ago, and the singing group is still running today with people who are in it from the very beginning, just showing up week after week. And we're using these groups to evaluate not only the outcomes of singing and the benefits of singing, but also to understand how to make this a more accessible resource. What's the flow of the participation? How are they getting referred to these singing groups? How are they finding out about it? Self-referrals or referrals through physicians, like all of these are reasonable ways to find the choir as long as they're finding their way into the group. And no presentation on the promise of music is complete without a few participant quotes. So I see it's getting cut off here, but this is actually from our pilot singing on prescription with the lung disease that I shared with you. I was nervous at first about coming because I get panicky and stuff, but everybody was really warm and open. And if you start coughing your head off, you know we were all in the same boat. When I leave here, I feel really good. I didn't know I would feel this good. Here's another lung health choir participant. I had given up on so many things in life. I'm living again. It makes you feel like you took a little bit of control over something that you don't control, the disease, but you're helping yourself and doing something that is positive for it. It gives me hope. And here's a speech language pathologist who runs one of these singing groups. She says, seeing the choir members help and encourage each other and that mutual aid piece, it just reminds you that people are good. So here we see themes of hope and belonging and empowerment. I could do a whole presentation just on the participant quotes that we see. I know you could do the same. Any next steps, you can check out our website where all of the resources that I mentioned, the singing map, the best practices, all of the latest research results are posted there, so you can find the different studies that are happening across Canada and internationally. And this is where we are connecting with other community partners and building these collaborations to build a stronger network of individuals who are hoping to advocate for more singing groups across the country. And make referrals if you're a physician. Start making referrals now. Use the singing map. All right, thank you so much.
Thank you to our three panelists for these thoughtful and inspiring contributions. Together, you've shown that music reaches far beyond performance. It's a bridge to health, community, and belonging. Belonging is one thing that came back as a word, a strong sense, right? That came in all three of the presentations. I have a question now that I would like to ask to each of you, all three of you, if the first one wants to go, because that's something that I imagine a lot of people have as a question. Like, what's one concrete step that you can take to make music a stronger part of health and wellness system? Where to start? We're talking about social prescribing and sharing these initiatives, but what would be one concrete step that we could take?
Who's we? I think that different key stakeholders will be taking a different first step. So for me, as a researcher, my first step is to continue doing this kind of good quality research. We're starting to do these multi-site studies, so we're looking at singing groups in Toronto, in Montreal, in Ottawa, in Newfoundland, and we're connecting them and making sure that they're following the same protocol so we can see in different contexts what are the benefits of singing. And I think that's an important step for us, is to develop this, this body of evidence so that we can take that and advocate for these groups to exist.
Tina, I guess from the maybe the nonprofit, actually working in music perspective.
Yeah, I think from the more orchestra, of course, more programs like orchestra throughout the country and the world. But I think we also need to start within the schools, where music is so often dismissed. It gets cut as the first thing that can get cut, not just the music, the arts. And so that right there shows that they're not important. And I think we need to tip that on its head and understand how vitally life-saving the arts can be to a child's life. So I think we need to start within the education system, and also with the programs that are happening right now.
Sue?
I'd just like to echo what you're saying in the schools. And in fact, orchestra does have a program in the schools, right? After school. We, in the health system, I've got some pediatric residents that are doing little research projects. And one of the research projects is a systematic review on the impact of school-based programs on the mental health and well-being of children. So let's just gather the evidence, and what we're hoping to do with that, never on our own. We don't work alone because this has to be collaborative. We will be reaching out to, for example, Tina, to go to the school boards and just to say, look, this is what the evidence is. The Ottawa School Board's going through some issues right at the moment, but anyway, there are other school boards that we need to go to the decision makers, the stakeholders, absolutely, but the decision makers, and let's bring music back into the schools. So that would be the aim, is what you're saying. But the first steps is getting the evidence and collaborating with your community partners. And I have to say, the relationship that I've had with Tina over the last decade, I was echoing your recommendations in the one piece. So I would say from the one piece from issue from my side is the biomedical health system that I work in for the education of health professionals, all who work in the health system, to know about social prescribing, to know about the social determinants of health and how much that impacts health and well-being, and how easy it is, low cost, to be connecting the patients, clients, with community to bring belonging. They're already living in that community, but bring belonging so that they really feel they do belong. And tapping into the resources that exist in all communities. Actually, I hear so often people say, oh, there's no resources out there. There's tons of resources out there. Many of them are siloed off. And human capital resources, as we saw in our study, you reach out to them and you say, you know, these are our hospital patients, and they just want to be part of it. People are craving in this day and age now, particularly post-pandemic, because we've got so many more crises going on now. We already knew about the mental health crisis, the health crisis, we've got the climate crisis, we've got the economic crisis, we've got, I mean, you name it. Watch the news, it's all the crisis. Let's bring it back into our own lives, and very importantly to the lives of our kids and young people. To bring them on board as partners is incredibly, we need to be listening to them. They're part of the team to move things forward, to bring joy and meaning into our lives.
Tina, you wanted to comment on?
Yeah, I would just like to share another story. Back when we started early in our years, we wanted to create a program for our little guys. We tried teaching violin to 6-year-olds. Some people can do it, we couldn't. We chose not to do it in groups. So we created a program called Kiddlywinks for 5, 6, 7-year-olds. Our first program was actually after school in one school, based in a school, which is what is not normally how we operate. And it happened for a few years, and the school adopted us. And even though we were an after-school program, they invited us to do our concerts within school time for the teachers and the rest of the schools to see what we were doing. After about 2 years, the teachers came up to me and they said, we can, because the kids that were taking part were dotted around different classes. There wasn't just one class, because it was a voluntary after-school program. They said to us, we are seeing the difference of the kids in the schools during school time of the kids that are taking part in the after-school program. How can we get it into the schools? So that was the invitation for us to go to the school board, and we've been giving classes, Kiddlywinks classes, in the schools that they pay for since 2013. So, but that was a beautiful way for us to receive the impact of the program from the outside, because we don't get that perspective. So that was such a beautiful way of understanding the impact that was not biased, you know.
Yeah, that's a great story. Thank you for sharing. I don't know, Evelyn, if we have the time for a question from the audience.
So we are running out of time. However, we are going to have a break for lunch, so there's an opportunity if you have questions to ask our panelists in the lobby. Feel free to get your questions there. We'll be coming back at 12:45, back in an hour. We will be joined by Dr. Ahmad Sarmast of the Afghanistan National Institute of Music, who will discuss music in exile. But before we break, please join me in giving a final round of applause for our wonderful panelists.
I'd also like just to say a great applause to the orchestra youth who came all the way from Ottawa, and any other youth in the audience that are here to perform. Just one last comment to say that I learned a lot through you guys, because I was prescribing music. I thought music programs, right? I hadn't realized you were a social development program, which I have seen the blossoming and the flourishing. But I love that word, flourishing. Thank you so much. I'd gone to your concerts, And I was just absolutely astonished. At first, I used to think it was going to be like a high school. I don't mean to push down the high school choirs, but it was like at that level. And I was just astonished. I thought, this is like going to the NAC, your concerts. I mean, incredible, absolutely incredible. So thank you for coming. Really appreciate you here.